I've officially reached zombie mode. Had a cup of coffee. Did absolutely nothing for me. So now I'm heading to look for a Celsius. It's been crazy. So many rapids have been called today. I've lost count. All right, so today has actually been really crazy. It's almost the end of the shift for the day team, and I have not even had time to eat lunch yet. The last thing I had was breakfast, and I've literally been on go since I got here. Right now, I am just responding to a rapid response. The patient was having very low blood pressures, high fever, high heart rate. Looks like patient is septic, and they're dying from stage 4 lung cancer with metastasis. So just got back from that rapid response. Basically, I bolused her, got order for blood cultures, and that's about it because she's a DNR. So there's only a few things or a few options that we can do at this point. Also transferred her to a lower or higher level of care. It's called the step down unit. So that was what I just got done doing. And I also have a newborn baby that's really sick right now. And I'm trying to figure out what's going on. So I'm being spread thin today. But I'm gonna try to eat at some point, and I'll update you guys soon. So now that I have a little bit of downtime, it's 1:30 a.m. and a lot has happened today. And it's been a little bit of a challenge for me because I'm coming on service for the first time. I don't know any of the patients. I have to learn the entire list. I'm on a 24-hour shift. I'm responsible for newborn babies, all rapid responses in the hospital, as well as putting out all the fires that take place with taking care of 36 patients. So I did have one intern with me today, and I think I mentioned this earlier, but we split the list. I also still have to help him with anything that comes up with his patients because he's still learning. We all are, but he's an intern, so there's some things that he may struggle with, or there's some things with orders or something that may come up that he can't or doesn't feel fully confident with handling himself. And so that kind of takes away from whatever I'm doing, because I have to step away and help him manage his patients, which is not bad. I don't mind doing that, of course, but it does kind of makes my day a little longer. All right, I am heading down to the call room now to just try to lay my head down.
Going down.
Don't think I'll be able to do much of any napping or resting, but I'm just gonna go because I'm tired. I can barely think straight. Coffee feels like it should be kicking in soon, so maybe I'll get a second wind. Okay, so I've finally gotten to the call room, and the coffee has started kicking in, so getting a little bit of a second wind. But to kind of recap what today looked like for me, so obviously morning sign out when I got here, rounding on the patients, coming up with an assessment and a plan for the day, executing those for the 8 patients that I had, and newborn rounding. Then after that, we rounded with the attending for our morning rounds. And in the middle of all those, things. There's rapid responses going off. So far, I am a little over, probably about at the 16-hour mark. And we've had 8 rapid responses. So pretty busy day. My day started with a transfer to the ICU for one of the patients. This guy was 82 years old. He has a history of COPD, very well controlled on just nebulizers. He's not oxygen dependent or anything like that. Otherwise, pretty healthy guy. Came in with acute hypoxic respiratory failure secondary to COVID. And this guy was in good spirits to begin with. Didn't really have any major issues, but started having some severe respiratory distress and high oxygen requirements. And he was admitted last night. And when I got here this morning, I noticed that his heart rate was in the 40s and his respiratory rate was through the roof. So I'm thinking this guy is actively like crashing. So I go to bedside and he's sitting up in the bed, talking and joking, having a conversation, but he has this BiPAP machine on. A BiPAP is basically CPAP on steroids. So he's sitting up with this huge mask on his face. You can barely hear him because it's just forcing air into his mouth and into his nose and into his lungs. And he's on 100% oxygen. And for reference, you and I, without any supplemental oxygen, just atmospheric oxygen is 21%. And we usually saturate, you should be saturating close to 100% on that. So this guy is on 100% oxygen and he's saturating at 88%. There's nothing beyond 100%. So that's all you can, that's as much oxygen as you can give someone, and it wasn't enough. So he was at risk for acutely decompensating and dying because of his severe viral pneumonia. So I immediately transferred him to the unit because he needed to be intubated and mechanically ventilated. So that was how the morning started. That was probably before 7 a.m. So the other big deal that happened today, aside from all the rapid responses, of course, which were basically little fires that I just had to put out. Of course, when I say there's a team of us as well. Usually with every rapid response, you have the nurse who responds, the charge nurse, you have respiratory therapists, you have the lab, you have vascular access. So everyone comes to the bedside, and there's a team of us in the room to take care of this patient. The attending physician usually does not respond. It's usually the resident. So I'm the only one that can actually place orders. So those things are usually handled by the resident, and they're just little fires that you have to put out. Now, the newborn rounds are a little different. This is relatively new to our program because we had a pediatric group that left, and so we have adopted the care of these newborns. So I had to round on 3 babies this morning. I did 2 circumcisions, which was pretty cool. And one baby had an extra digit, like an extra finger. They call that polydactyly or supernumerary, I always mispronounce that, supernumerary digit. And he basically had it on his pinky. So I ligated that and amputated it off with my attending, which was also pretty cool because that was the first time I've ever done that. So pretty quick procedure. You basically tie a suture around it, being that it didn't have any bone involvement. It was pretty superficial, only involving this superficial skin. So you just tie a suture around it. You pull it really tight to cauterize it and slice it off with the scalpel. So that was pretty cool. And I had one baby that gave me a little bit of a hard time this morning with some respiratory distress. So that baby ended up getting transferred to the neonatal ICU for something called transient tachypnea of the newborn. And I guess I'll tell you what that is. So it's basically where baby's born and there's still fluid present in the lungs from being in the womb. So the babies, when they're in the womb, they don't actually breathe air like you and I. Their lungs are actually full with fluid, amniotic fluid. So they get their oxygen from the placenta. So usually when babies are born through the vaginal canal or the birthing canal, that helps to stress them enough so that they absorb this fluid naturally. And they take their first breaths once they are out of the womb, and they're able to resorb the rest of that fluid into their bloodstream and into their lymphatics. Well, some babies, depending on what their risk factors are, or depending on how they were delivered, whether it was by C-section or if they were premature or whatever the case was, some babies have this fluid still in their lungs when they're delivered. And so this was the case with this baby. He was born by C-section at 40 weeks, so he was full term. But being that he was born by C-section, he didn't pass through the vaginal canal, so there's less stress hormones and more of a risk for transient tachypnea of the newborn, or TTN. And so that just means that the baby comes out, but there's still a lot of fluid in the lungs that the baby has to breathe off, reabsorb, and get rid of. But in the process, the baby's pretty distressed during this process. So you can have elevated heart rate, breathing really fast, grunting, or using intercostal muscles to breathe, or accessory muscles to breathe. So this baby was actually pretty dusky looking, kind of grayish in color. So he was struggling a little bit. I ended up getting an x-ray and some blood work just to make sure nothing weird was going on, but I was pretty confident that's what was going on, and kind of followed him throughout the rest of the day and when he went over to the ICU, and that's what the neonatologist agreed with as a diagnosis, being that the rest of the workup was pretty negative or normal or within normal limits. So that was a pretty interesting case. Yeah, so we'll pause there for now.